Okay, I want to talk through some specific things about your new baby before baby arrives. Now, there's a couple of different things. So this is kind of like all the curriculum that I like to go through with parents before baby arrives, just so you have an idea. Like there's a lot of different aspects, from common weird stuff that babies do to like how to have good resources before baby arrives, in your mental health and pregnancy and baby health and, sleep prep, gear prep, all those sorts of things. Today, I want to talk about, at baby's arrival, all of the common weird stuff that parents ask about and aren't sure about, but it's all normal. So the first thing that I hear a lot from parents, especially like they get home from the hospital and they've had baby for 3 or 4 days now, they're seeing hiccups and sneezes just all the time, and they're worried that their child is allergic to their cat or their dog or something in the home. Hiccups and sneezes, periodic breathing, these are common things that happen to babies because of their immature nervous system. The other one I would add there is usually like a little bit of like the jumpiness. So like baby, their blood sugar's not low or anything like that, but they're a little bit jumpy. They hear noise and they kind of react strongly to that. That's what newborn reflexes. It can be a little bit jumpy like that. Hiccups and sneezes are entirely normal, and you will see them for the first few weeks of life. There's nothing specific that you need to do for them. It doesn't mean that your child is allergic to your cat or dog. In fact, there are a lot of studies that show that early exposure to cats and dogs actually decreases overall food and environmental allergies, because it's kind of part of the hygiene hypothesis, right? So they're getting more exposure to those things, and so to different allergens, and so they're less likely to react. So hiccups and sneezes are entirely normal and a good thing, and getting exposure to cats and dogs, I have a preference for dogs, is a good thing as well. Now, spitting up is entirely normal. When we're talking about spitting up in the first few days of life, it's mostly from swallowing amniotic fluid. So amniotic fluid gets swallowed during the birthing process, and it's not easy for baby to digest, and so they'll be irpy and they'll spit up for the first few days. It doesn't mean that anything is wrong with them. It just means that they have this amniotic fluid that they have to work through. Now, in the hospital, sometimes what they'll do is they'll stick a little tube down their nose to suck out their stomach if they're being really irpy. That just helps to get that gunk out so that they can start then more easily digesting milk and all of those things. Sometimes baby will swallow a lot of air too, and that will just make them a little bit distended and irpy as well. And so spitting up is also normal in those first days. A little bit different than spitting up as they get older. Those first few days at baby's arrival, the spitting up is a little bit different, but spitting up in general is normal, because if you think about the esophagus and then here's the stomach, the valve that's right here is pretty loose, and so what happens is we get a little bit of abdominal pressure, like if we're sneezing or coughing or anything along those lines, and the milk just comes right back up, or crying or anything like that. All of that can do that, so it's very easy for babies to spit up frequently. Now, newborn rash. Your baby on day 2 will often get all these little spots all over their body. They actually look quite a bit like this little laser pointer thing that I'm using here, because they're red and then they have a little bit of area around them, and sometimes they'll be white in the middle and then red on the outside. Entirely normal. It has a scary name. I don't know, somebody was being quite the jokester when they came up with the name erythema toxicum, which, who doesn't love it when your doctor comes in and says, I'm here to tell you that your baby has erythema toxicum. Normal baby rash. There's nothing that you need to do for it. It goes away after a couple days. You can just reassure grandma that this is a normal baby rash, and they don't have measles or anything along those lines. Although nowadays that is something that we have to kind of like be more careful and talk about in a different way than we did in decades past. But erythema toxicum is a normal baby rash that just is all over baby. After a few days, it goes away. Periodic breathing. This is another one that relates to the immaturity of the nervous system. So babies will breathe fast and babies will breathe slow. What you'll see is baby, and at some point they'll be breathing fast, and then they'll compensate by breathing slow after that. And they'll do that over and over. It's not all the time, but they do go through periods of that. That's because their nervous system isn't great at regulating their carbon dioxide level. We want our carbon dioxide level to be something in the blood, like it can't be 0, but it can't be really high either. And so if your carbon dioxide level goes up a little bit, then what baby will do is they'll breathe fast to bring that level back down. And then they won't have any carbon dioxide in their blood, or it'll just get lower than it should be. And so then they'll breathe slowly to let the carbon dioxide level rise back up. And so this is a function of just their immature nervous system and not being able to well regulate their carbon dioxide level, and it doesn't mean anything's wrong with their baby. Now, if they're breathing fast persistently, like they're breathing so fast for so long that they can't eat, or you're pretty concerned because they just keep breathing fast, obviously that's entirely different. This does not bothered in terms of baby eating or doing all their regular things. They just do it from time to time, and usually it's when they're asleep. Now, the next one is brick dust. So brick dust is something that occurs usually in the first day or 3 of life, where they will have a little pink discoloration of urine. And this worries parents because they open the diaper and it's like, is my baby bleeding? Like, are they peeing blood or something along those lines? These are little crystals that are in the blood, or in the urine, that just have to get washed out. And so what you'll see is it's not quite as red as this laser pointer is. It's just a little bit of a pink hue in their diaper, and it goes away after a couple days. And as they get more liquid on board, they get more hydrated, you'll see less and less of that. Now, the umbilical cord is just another thing that is often parents aren't exactly sure what to do or what to make of the umbilical cord. So the umbilical cord obviously was how baby is getting all their nutrition. When baby is born, they cut the cord, they put a little clip at the bottom of it so it doesn't continue to bleed, and those sorts of things. And then it takes about 2 weeks for the umbilical cord to dry up and fall off. That's a normal time course for the umbilical cord to completely be gone. Now, during that time, what you'll notice, it is essentially like rotting flesh. The umbilical cord is not getting oxygen, or it's not getting blood supply or anything like that. It is essentially rotting flesh. So it's normal for it to have a little bit of a smell to it. And it's normal for it to have just a teeny bit of discharge or blood, especially as it gets close to the time of falling off around 2 weeks. And so those are normal things that you'll see. Now, it would be abnormal if it is really red, swollen, or tender. Those would be things that would not be normal, not normal. But that would be very rare. That would not be a common thing that we see at all with babies. And so the best thing to do is leave it alone. In the olden days, they would put alcohol wipes or rubbing alcohol or all of these different things on umbilical cords to try and help. When you put alcohol on it, it just turns into mummy flesh that never falls off. It falls off, but it takes a lot longer. So just leave the umbilical cord alone. Now, if this has been helpful, subscribe. I'll keep making these because I do find it helpful to kind of talk through all these things so that you know what to expect. It decreases anxiety when we feel like, okay, I know what's going on with baby. I know what to expect when it comes to feeding, when it comes to the hospital stuff, when it comes to weight gain and typical weight loss and all those sorts of things. I'll do more of those. And if you have questions, drop in the comments. Have a great day.